Each year, there are close to 3 million reports of suspected child abuse filed in the U.S. More cases go unreported. In New Jersey, 48,000 children are under state supervision because of threats to their safety and welfare. Hi, I'm Dr. Lawrence Dobrin, a participating dentist with Delta Dental of New Jersey and the chief forensic dentist in New York City. I'm also the spokesperson and educator for Delta Dental of New Jersey's PANDA, or Prevent Abuse and Neglect through Dental Awareness Program. It was started by Delta Dental of Missouri to help break the cycle of child abuse through education of the dental community. The link between dentistry and preventing child abuse is this: 65% of child abuse injuries occur to the head, neck, or mouth areas. Dentists and other professionals working with children are in an ideal position to notice the signs of abuse. Studies show that professionals trained in child abuse prevention are more likely to report suspected child abuse, and that reporting could save lives. A dental surgeon who attended one of my PANDA classes shared with me that he recently treated an accident case, a young boy who had supposedly injured himself falling off his bicycle. His staff had mentioned to the surgeon that they didn't believe the mom's story. He brushed it off at the time until he learned about the signs of abuse. He went back and revisited the case and realized the injuries didn't match the parents' explanation. That's a common sign of abuse. He decided to refer it to Child Protective Services. Sometimes it's an injury that you don't see. A mother brought her 11-year-old foster child in for a checkup at my dental office. When I walked in the room, the young girl became hysterically upset for no apparent reason. I immediately walked out of the room to speak to the foster mother. Because of my training, I suspected sexual abuse, and my suspicions were later confirmed. Had I forced the girl to undergo a dental exam, I could have further traumatized her. Instead, we referred her to a female pediatric dentist, and I alerted social services. Over time, the young girl has returned to my office, and I was able to treat her. She is slowly learning to trust again. These are just some of the stories behind the numbers. Many of our health professionals start by looking for neglect. They might notice that a child hasn't bathed, has lice, or has badly decayed teeth. Parents and caregivers under stress may not be aware that what they're doing is abuse and that the child is suffering. They may not understand that their form of discipline or neglect is dangerous. It all starts by knowing when to alert Child Protective Services that there could be an issue. Only then can steps be taken to make sure the child is safe. Educate the parents and caregivers and stop the cycle of child abuse. If you suspect possible child abuse or neglect, please call 1-877-NJ-ABUSE. In New Jersey, anyone who reports suspected child abuse in good faith is immune from prosecution. By reporting your suspicion, you might save a child's life. And for those dental professionals or others who work with children, including nurses, teachers, and social workers, interested in learning about the signs of abuse and neglect, please call 973-285-4000 to schedule a free PANDA presentation. We ask that you have at least 10 people in attendance, and I'll come to your location at no cost. PANDA is funded by the Delta Dental of New Jersey Foundation. Let's work together to prevent child abuse and keep children safe and smiling.